On this episode, we'll talk about menstrual cycles after your sleeve, we'll talk about staying hydrated with the gastric sleeve, and we'll talk about chemotherapy after the gastric sleeve. Hello everyone, welcome to the AskDrA show. In this episode we got a chance to be here in Los Angeles, downtown LA. We're here in front of the Staples Center where the Lakers just unfortunately lost a few days ago. We went to the game, but we had fun. So we're here at the ASMBS surgical conference, and we didn't want to miss the opportunity to be here with you and bring you the AskDrA show. So let's jump into the questions.
Is it normal to have my period again if I just had it 1 week ago before my surgery?
So menstrual cycles, I have a video on the frequently asked questions on our YouTube channel, so you want to go and see that, alright? So I'm just going to make it really short for you. Very common to have menstrual cycle changes, to have your period either earlier or to come back a little further down the road. Why is this? Two main mechanisms. One is stress. You just went under, just had surgery. Stress changes hormones, causes hormonal imbalance, and it's causing you to either have your period earlier or a little after. And the other thing is hormones. The other thing is once you start losing weight, drastic weight loss causes also this imbalance. Be sure to look into this YouTube video I did a while ago. You may type in menstrual cycles gastric sleeve and it will pop up.
Since my sleeve in July 2015, every time I try to drink water, it gives me nausea. Why is this happening?
Alright, staying hydrated. I've done a couple of videos on hydration, especially with water after the gastric sleeve. You got to keep two things in mind, that the sleeve has phases after you had your surgery. Initially, you're at the top peak of restriction. Water doesn't agree with you. Remember that plain water doesn't agree with you well the first 2 or 3 months. So you may want to add a little extra packet of iced tea or flavored Crystal Light, something that changes the osmolarity of the water, and it'll go down nicely. Totally different than with plain water. The other thing is, after a few months, water will agree with you. It's like your own regular stomach as before surgery, so don't worry about that. Key of staying hydrated, especially those first few months, sip weight. Always quantify. It's very important. If you don't quantify, you don't know how much water you're intaking. So you need to keep up a record, a diary of how much water intake you are having.
I just started chemo and radiation this week. Will this damage my sleeve?
Alright, so unfortunately, chemotherapy after the gastric sleeve. Unfortunately, some of us may have some type of cancer down the road, maybe not. The thing is, you can have chemotherapy cycles. In this case, this patient is asking, she's going to have chemotherapy sessions after breast cancer. Will she have any impact on her sleeve? The answer is no. The best advice is tell your oncologist about your sleeve so she can actually keep it well. What do I mean by keeping it well? Well, maybe do some antacids or PPI medication to keep your sleeve in good shape while they're giving you a big amount of medications or radiation or chemotherapy medication. Alright, so there you have it. That's it for the AskDrA show on this episode. And be sure to send us the questions with the hashtag AskDrA. And the other thing is, question of the day. Do you keep track of how much water you take? How much fluids you intake? Yes, no, the answer's right here. I'll see you on the next episode of the Ask Dr. A show.